So tell me more about ALK positive patients and what happens post lorlatinib.
And so lorlatinib is our latest and greatest therapy in terms of targeting ALK rearranged non-small cell lung cancer. The resistance phenotype for patients who progress on lorlatinib may be unique in the sense that the mutations often are in the ALK kinase. And several of these patients have actually gone on to have mutations that are sensitive to other ALK inhibitors. And so the idea that precision medicine, understanding the tumor, whether in the context of a clinical trial or in a standard of care setting, is crucial in understanding which therapy best matches to a patient's cancer. But the idea that we may be able to go full circle in some patients, in which patients who progress on lorlatinib may be sensitive to other ALK rearranging targeted therapies, is one of the areas we're most interested in.
Right, so I've heard of a patient going from lorlatinib back to crizotinib. You've seen more of this happening?
Yep, it's definitely one thing we've seen. And the other thing that's unique is some of the cell-based immunotherapy studies. There's some interesting data for taking T cells from within a tumor microenvironment for patients who have molecularly rearranged cancers. And depending on when you collect those cells, you can try to amplify the ones that are most likely, the T cells, to attack the patient's cancer. And so while the PD-1 inhibitors tend not to be effective in this disease because there are not a lot of T cells that target the cancer, the idea that we can generate a T cell from the tumor microenvironment, amplify it outside the body, and create a personalized, bespoke type cellular therapy is an area I'm personally very interested in and hope we can utilize to bring that benefit of immunotherapy to patients who have driver mutation cancer, who often are best served by pills today, in which PD-1 therapy hasn't been as efficacious, but the concept of immunotherapy has yet to be fully realized.
Yeah, well, thank you for the work that you're doing, and I hope it'll go really well because there are a lot of us who are wondering what's happening next, so what's going on. It's good to hear.
I think the best is yet to come, and I'm so glad to hear that so many patients are able to access to lorlatinib, which is probably our latest and greatest therapy.
Yeah, for sure it is. Anyway, thank you again, Dr. Patel.
Yeah, thank you.
It's so good to meet you.
Likewise. I'll find you on Twitter.
Yes,
Yeah.
awesome.